Welcome back to Pappas in Cockeysville. We're here live today. It's a beautiful Friday. It's hour 34, kicking off of 40 hours. I got 6 more hours. We'll be here till 5 o'clock today. Come on by. It's all brought to you by our friends at the Maryland Lottery. I'm giving away the 10x the cash, 10 times the cash. I gave one out to one of our guests yesterday, Tom York, and he texted me like 3 hours later with the scratch doll thing. He actually had the 10xer. He won $20. It was only $20, but $20 more. We are doing a cup of Super Bowl. It is Crab Cake Row. Come on out. Bring some good stuff for the Maryland Food Bank. We will give you a free cup of soup or bowl of soup. Maryland crab, cream of crab, or the way I've been taking it lately, which is a half and half. Our friends at Window Nation, 866-90Nation, as well as Jiffy Lube Multicare, putting this thing on. I have reached to folks, and everybody has the same question. They're like, why me? Why us? And I'm like, because you're CareFirst Blue Cross Blue Shield, and I knew Brian, and I was reaching to him, and this and that. So you're a big company, so I'm going to reach harder for Brian next time, bring him in. But she's going to give us everything we need to know. Destiny-Simone Ramjohn is here from CareFirst, Blue Cross Blue Shield, but I'm going to call it CareFirst because, I've been saying Blue Cross Blue Shield for 55 years, right? Like from the very beginning. CareFirst and Blue Cross, same thing, right? But just CareFirst is what we call it.
That's right. Ness, well, first let me just say thank you for calling us. We're just happy you did. We're really proud to support Crab Cake Row. As you noted, Brian Pinnock and CareFirst Blue Cross Blue Shield care deeply about communities. We care deeply about addressing the most pressing needs, not just of individuals, but of entire zip codes and entire states. And so when we learned about the mission-driven approach you're taking to Crab Cake Row, we're like, sign us up. So,
well, I don't think anybody does more than, you're in my wallet. You're in, most people's wallet.
So glad
for my wife, she gets picks of insurance, and she's diabetic from the time she was 19, so she always picked, better insurance. But we saw folks that had insurance needs. My wife spent 155 nights at Hopkins, 2 bone marrow transplants, $2 million worth of insurance, and then there's, job insurance and keeping expenses going.
That's right.
We were. I have a success story to be here. It'll be 10 years next month to be able to tell, and people come up every day, how's your wife? How's your wife?
Yes.
It's just, I get that question more than any other question. She's great, but she's great because we had insurance, we had doctors, we had science, we had research, we had charities like There Goes My Hero and LLS. But you're in on all of that because, if you're at the, you catch cold this weekend, you're going to pull out the card, right?
That's
Literally.
right. Well, I'm really grateful that your wife is doing so well, and that's how we want to approach the health of every single one of the lives that we cover at CareFirst Blue Cross Blue Shield. Our mission boils down to 4 central components: accessibility, affordability, equity, and quality. And equity being one of the most important, right? It is important that we love folks that carry our card in their wallets, in their purses, in their back pockets. But we also know that most of what contributes to your health happens outside of your doctor's office. How many hours do you think you spend with a physician, the average person, each year?
Me or the average person?
The average person. Average person.
So
just take a wild guess.
Somewhere between me, who hasn't been in a doctor's office until the last time something really hurt and I didn't want to go, which was 2 years ago when I went to a surgeon.
Yeah.
I have an L4, L3, which is why I'm sitting on. I'm a little messed up today. I don't want to reach for the card, though. I'm not going to do it. But my wife, because of her diabetes, because she's a woman in her 50s, because she's a woman who survived, she has. If I were to open my phone and just pull the pink color up, because I use everything in my calendar, there's her doctor's appointments that are pink, between bone density doctors. She doesn't have any cancer doctors. People come up and they think, cancer, 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 you must be seeing. She hasn't. She's been set free from that. But she has a lot of issues. We all see, I have glasses on, so I'm using insurance. I have nice teeth, so I think there's a lot of things. So if you're counting my dentist, and if you're counting
a part of the body.
Yeah, if you're counting my eyes, and I got to go see him for my reading glasses soon, not a lot for me, but I would think people, once you get to be my age, my wife's at the doctor's once a month for some kind of doctor in some way. But she's more than the average bear, I think.
Yeah.
Yes.
Okay. So the average person, right? So we have folks that need much more care, folks that are much more hands-on. The average person spends about 90 minutes per year in their doctor's office.
In their doctor?
In their doctor's
you're talking
office.
primary care.
Primary care and specialists,
Okay.
and
All
kind
right.
of our vast network. Now, certainly that's one of the pride moments for CareFirst is the vastness of our provider and specialty care networks. But if we go to that 90 minutes, the larger point being, if you've only spent 90 minutes with your doctor, your health is happening outside of your doctor's office,
364,
right?
22.
Absolutely,
Yeah, right.
yeah. So that is, your health is happening in the places where you live, in the places where you work, in the places where you pray, where you seek care. All of those social and environmental factors actually contribute much more to your health than than the 20% or so that happens in your doctor's office. So when you think about Care First, we want you to think about your doctor for sure. We also want you to think more broadly about the social and environmental factors that happen outside your doctor's office. And that's where our mission shows up. Our mission and the core of our business imperatives show up more. So when we think about the kinds of partners that actually produce health, we're not just thinking about our great and amazing hospitals that we have in Maryland, D.C., and Virginia. We're also thinking about our employer partners who provide strong incomes and livelihood so that people can access healthcare coverage. We're also thinking about educational partners who help people access high quality education that then help them maximize their job potential and learning. And we're also thinking about the core elements of what makes a neighborhood safe. And transportation, right? It's important that you are a card-carrying member of our product. But if you have to work late and you can't make it to the doctor's office, that's not doing you much good, right? If it's going to take you
I had
2
somebody this
hours
week
to
had a
get to the
doctor's appointment. It's
doctor,
like, we can't get an appointment until April, but it hurts now.
yeah,
Right,
yeah.
like literally, and that's an issue as well. But you mentioned transportation.
Yes.
I talk so much about that, just in regard to food and jobs and different things like that. The transportation. If my wife couldn't get to the doctor, right? I mean, she grabs the car. Like a day like today, we were a one-car family, so I have the car here. She won't make a doctor's appointment, but that's our little stupid issue. Is hey, Thursday, I need the car. I got to get down to Hopkins or whatever. For a lot of people, it's like a whole day, and it's a whole day off, and sometimes these are the most challenges. And we certainly saw that being. My wife was treated at Hopkins, so she's on the bus line down there. But we saw people come in and out, and I often wondered, like, it would take me 8 minutes. We lived at the harbor. We were blessed, I was at the hospital 3 times a day back and forth. Transportation, I really did think, like, for loved ones, for anybody, how easy it was for me, but how I could see it was easier for me than anybody else in the building.
Yeah,
that piece of it,
I got to tell you, I know I'm not Brian Pinnick, but if he were sitting here, he would give you this data point.
Sure.
Did you know that if you have a car in Baltimore, you can reach 100% of jobs within 1 hour? If you don't have a car in Baltimore, you can only reach about 8.5% of jobs within an hour. So
I had vehicles for change on the other day.
Oh,
Just talking about
beautiful.
Yeah, just talking about like what a vehicle means to a family, a working family that could not afford a vehicle.
Correct. So when you think about your access plummeting to 8.5%, what that means to us is if you can't access a job, if you can't access your doctor, that is going to compromise your quality of life and your length of life. And that's what CareFirst Blue Cross Blue Shield cares about. It's how do we go further upstream, right, out of the doctor's office, in some instances outside of traditional spaces that people think of when they think of healthcare. So one of our strongest partnerships is with the Enoch Pratt Library.
I had Megan on Monday.
Did you?
Yeah, I
we
love Megan.
love Megan and the team. So
We talked a little Jade and Will. Just a little bit. Did a little bit of that.
well, we will talk about the partnership that we have. We're not touching that with a 10-foot pole.
No, they were at Enoch Pratt. It was a big thing.
I recall that was fantastic.
It was their Taylor moment, is what it was. So yes.
So as far as the Care First moment with Enoch Pratt, we have a great partnership, which is bringing behavioral health counselors, peer navigators, social workers, and related behavioral health providers to the library, a site that ordinarily one wouldn't think of to seek for health care, right? But what we've said is, what are those trusted spaces, those trusted partners like Enoch Pratt and others that already have spaces and sites of service, and how can we expand that to think more broadly about health and wellness
Well,
in
I think
critical
COVID
ways?
did that for everybody, right?
Oh,
I mean, during
my.
COVID, we were just doing things that were unprecedented in so many ways. I mean, I talk about food insecurity and, handing out bags of food, for people during COVID because the grocery stores were going. The overwhelming, overburden, onerous part of this fell on the medical community. I
That's
mean,
right.
just front to back, insurance, jobs, all of that. You were tested, right? I mean, as a system, I think every hospital, the whole thing was tested.
Yeah, I couldn't agree more. I think Brian would say the same. It was a challenge not just for payers and providers, but for our planet, right? This was a major disruption that was unprecedented, unanticipated. What I do appreciate about our empathetic and executive leadership, including Brian, including Lester Davis, and our entire executive leadership team, is that they were compelled to act. This was an all hands on deck moment from our care managers who were contacting individuals that were vulnerable, that may needed an extra layer of support, to our physician partners who may have needed accelerated payments because patients weren't going in the door, to our federally qualified health center partners who didn't have PPE, and we set up a $5 million personal protective equipment initiative to ensure that they were able to deliver care at the front lines in ways that disrupted the supply chain because they couldn't access the PPE. And CareFirst was their partner, kind of hand-holding to say, no, we want you to still be able to be on the front lines safely, protectively, and certainly able to meet the needs of the population. So yes, COVID tested the system, but I think COVID also shed light on those social factors, right?
Sure.
Young people who were not able to go to school now having to access learning on their devices at home, but may not have had laptops before.
Or Wi-Fi.
Or Wi-Fi, exactly, presenting digital equity issues. We also know, as you pointed out, food insecurity was a major issue. So we partnered with Tiro, with Under Armour. John was a leader in that work.
People aren't eating, they're going to get sick.
You got that right.
Yeah.
Right? Have you ever tried to learn or come on the radio on an empty stomach?
We
It
told a
doesn't
story
work.
on Tuesday. I think it was Christy, but I'm not sure, from St. Francis, had a young boy that was, real behavioral problem, tested ADD, all of that. The kid was starving. The kid was starving.
Yeah.
And at that point, they're going to be in your system, right? And they're going to be using their card if they have insurance at that point. Destiny-Simone Ramjohn. I was worried about the pronunciation of Ramjohn, but you're like, no, my people are from Trinidad. We're old school sort of British pronunciation. So, I don't know. What is your title at CareFirst Blue Cross Blue Shield?
I am proud to serve as Vice President of Community Health and Social Impact.
There you go. All right. You're going to say that because I don't even have that written down here. Here's my question for you, because my wife, we have CareFirst, and I pull my little card out, and I don't know my little number or whatever. I always have it with me when I'm traveling because I'm always like, if I was out West Coast a couple weeks ago, you want to have insurance, you want to feel good about it. I don't think about it, right? Like, I had my finger cut off when I was 3 years old. There was a lot of insurance in that. I had my appendix. They burst. I actually had two kinds of insurance then, my parents and a work insurance. And then they fought for a year and a half as to who was going to pay for it. But that was 1986. I had a little thing on my head. I had a back thing 3-4 years ago. I had a shot. It was awful. But I don't use that little card much. You know what I mean? I really don't. Now, meanwhile, my wife has burned it up for the family. She's used it enough for all of us, right? And my wife, as it turned out, was a first responder for 9/11. My wife was a tech to put Wall Street together, and she breathed in the air. 11 years later, she's got leukemia, and we didn't find out that it was 9/11 based until 2018. So she burned a hole in her insurance card for everything. And I remember being at the hospital. The lady in the next room needed patches for her nausea, and the insurance on the copay for her prescriptions, she couldn't afford it. These patches were $500. My wife had a bag of them because we had better insurance. I want to ask you this, and this is sort of a random question, but like, my wife selects our insurance. It's her employer. She takes whatever the platinum thinks. She's scared to death about her. She gets medications in boxes. And back when she was checking her own sugar, she now has the little
glucose.
She has the same thing Mark Andrews. I'm trying to get the corporate name for it. It's a monitor that her phone tells her sugar. It's not a pump. She still injects herself, but she has all of these drugs that I don't really even understand. I've been married 21 years. I know how to like resuscitate her. She gave me that drug the other day. It's a new drug. So I have all of this stuff, but she picks the insurance. She has a great job. She's had the same job for 32 years with the same people. She works for Verizon, and they have the gold plan with CareFirst. Like so. But she checks that box. I haven't looked at an insurance plan in my adult, like literally. So I am independently, doing that. Do you give help if I had to pick? Because I would be lost if I had to pick and I know it's probably the most important thing you can do.
Yeah.
I mean, really it is. If I learned that when things went bad to say, is this covered, is this not covered? When I think of CareFirst, I think about a thing like this and utter confusion as to, all right, if I break a nail, it's a $20 copay. If I get cancer, it's a bad. And if I get in a car accident, what happens to me? And I think I talked to Leonard Raskin. I want to give him, I feel really bad for him. He's in Wailea right now. He's on the beach in Maui.
Oh.
It's terrible. He'll be back tomorrow. But Leonard tries to straighten me out on insurance and different things to make sure that if there is something catastrophic that happens, that you have the right insurance. And I think you want the people to have the right insurance.
Completely. Well, Ness, here, a few things come to mind. One, just thank you for your wife's service. I'm a native New Yorker, and my mom was at the site of 9/11 on the day, and so it's something that we think about a lot. And we know that having exceptional coverage ensures that you can manage the health conditions that you're presented with. It is my job to ensure that when I leave here, that you and your listeners don't just think of CareFirst as the folks that are in your back pocket. We are your partner in creating health with care. That means before you ever need to see a doctor, you should be in deep relationship with CareFirst. For example, we offer Noom, which is a digital product that helps manage food, nutrition, and ensure that you achieve your healthy eating and weight goals. Yes, it's called Noom, N-O-O-M.
N-O-O-M.
For many of our members, a product that has nothing to do with your doctor's office. We also offer CloseNet,
See, I look
which
this
is
stuff
our
up right
virtual.
away, is what I do.
Okay.
I don't wait. I'm right on it. I want to learn.
We also offer CloseNet, which is a digital front door for healthcare providers, for folks that are on the go and may not always have time to go into a doctor's office. You mentioned needing some support in interpreting your benefits. We have an entire community engagement center located right in Canton. Would love to bring you down and talk to our professionals. Let's read that explanation of benefits. Let's learn more about what is covered. But most importantly, you are probably not maximizing your benefits. There are so many opportunities that we afford. And we, in addition to wanting to make sure that when you need care, you can get it without any barriers, we want to make sure that we're doing all of the preventive components so that you don't get sick in the first place. That kind of adage, an ounce of prevention is worth a pound of cure. Your prior amazing guest talked about the importance of screenings. So a part of the role of our care management and our utilization management team is to make sure that you've gotten those screenings. Well, hey, Ness, we see that you're about that age, you haven't gotten your prostate or colorectal
Here
screenings.
she is. I knew it was coming.
You haven't gotten your eyes checked in 12 months.
I feel like I'm on radio
so
row now.
we are your partner in health, not just in insurance, right? What does it take to be
Seriously,
healthy?
the card in my pocket has a whole lot more than maybe I know about.
You're darn tootin'.
All right.
And what I'm also saying is, to you and your audience, come on down to our CareFirst Community Engagement Center in Canton, right on the waterfront park. And it's great parking, and public transport.
Right by the
completely
Deer Burns
accessible.
Arena.
Right there,
I know where it
not
is.
far, exactly, off
Right.
of Boston and Clinton Streets. And what we do there, we have vision available, right? So we have some spectacles and more. But most importantly, what we have is a compassionate team that is there to walk you through all of your benefits, answer every question that you have, and then help you make the right decisions for where you are in your phase of life, right? What you needed 20 years ago may not be what you need today. And we're there to expand and make you aware of those most fully. I'd be remiss if I didn't mention, however, we know that not everyone has access to good jobs, right? Like a part of why employment is so important is because we want you to be able to access good and high quality health care. So we've also thought about ourselves as a leading employer and an anchor institution in the city, in the region, and across the Mid-Atlantic states. So one example, right, of CareFirst showing up as an exceptional partner, not just a payer, is with our new West Baltimore Workforce Collaborative, where we've expanded the number of jobs available in zip codes in West Baltimore's 21215, 16, and 17. You know how we were talking about that transportation issue earlier? Well, one approach would have been to buy everyone a car. Not exactly a sustainable approach. What we said was, if folks can't get to our jobs, Brian and Lester have said, well, let's bring our jobs to them. And so we've stood up in partnership with Coppin State University, the Center
Our
for
partner,
Urban...
we're the flagship for Coppin.
We love Coppin, Dr. Jenkins and Josh. We've also partnered with the Center for Urban Families, as well as Mondawmin Mall, to bring
Mondawmin's come back to life. We talked about that
yeah.
yesterday.
We
Yeah.
just...
Big investment over there.
Huge investment initiated by Tim Regan and the Whiting Turner family. And Brian saw that commitment and said, I want to be a part of that. I want to shape it in ways that are true to CareFirst's mission. And so we'll be expanding our footprint in Mondawmin Mall this year in 2024. And we're going to bring additional jobs, but also support and social services with partners like the American Heart Association, like the Maryland Food Bank, like Parity Homes, and others who address those social and environmental factors, as well as the clinical ones we've been talking about
She
today.
said a couple buzzwords there. Coppin State, that came up earlier. The Mondawmin and Tebow Mannequin, that came up earlier. And you just said the Maryland Food Bank.
Yeah.
And I'll let you end on this, just about food insecurity. We've talked about it all week. I had Carmen here for about an hour yesterday over at State Fair, just talking about I think COVID shed light on that part of that, and thinking it goes away. It's always here. And the thing I've been heartened about all week is the concept of pantries, the concept of sort of a marketplace where there's no shaming, and just the fact that I've been heartened this week by meeting so many good people who are feet on the street and doing this work and need more light shed on it and more support from everybody, from CareFirst and the Maryland Food Bank and all these people that are bringing this stuff together.
Yeah.
But you see it every day.
Yeah, Ness, I gotta say, I've noted the strength of our external partners, but you do see I have on my CareFirst blue today.
You do.
We, if you don't know, or if your listeners don't know, we call ourselves difference makers because the mission is so important to us. It's important for us to show up for one another as a workforce, and it's important for us to collaborate with external partners like the Maryland Food Bank and others in service. And I am really proud to tell you, I'm really proud to tell your listeners, in 2023, CareFirst Difference Makers volunteered 75,000 hours of skills-based and service-based volunteers to 400 organizations across the Mid-Atlantic states. So what I would say is it's not just me, but I get to represent the 7,500 plus members of our workforce who are showing up each and every day to address educational outcomes, to address food insecurity, and to do so with partners that are on the ground and doing this meaningful mission-driven work. Partners like you that help us amplify the message, because that's another role we want to play. Like, we have a fairly well-known brand, but there are other smaller nonprofit organizations that are doing the work each and every day that we want to use our platform to lift up. So each year during our Week of Equity in Action, we partner with 30 organizations, Parity Homes in Baltimore, Smile in DC, and other organizations that do it as much as we do. So I guess I would end on one of CareFirst's mantras. If you want to go fast, go alone. If you want to go far, go together. And CareFirst's contribution and commitment is to partnership by going together with organizations to help address the most significant social and environmental factors in our region.
Destiny-Simone Ramjohn from CareFirst here. Give Brian my best. A little fist bump there.
I sure
appreciate
will.
you. I appreciate you, all the work you do. And I think the first thing you said is, why did you think of us or call? Well, sort of a couple $1 million worth of insurance and different needs that my wife's had, and my wife is, you're a central part of the mail that comes to the house and, things that happen that keep her alive and well. And we're appreciative of that.
That's what we're proud to do for 3.6+ million members, and we'll keep doing it. Thank
All
you,
right.
Ness.
Well, you are, I feel like Oprah. You get a lottery ticket, 10 times the cash. We did have a 10 times winner
Thank you.
yesterday. It was 10 times 2, which is still $20. I'll take that. We're out here, Pappas. We are doing a cup of Super Bowl. It is Crab Cake Row. If you bring us stuff for the Maryland Food Bank, I put it on the table over here where I'm drinking all the water. I didn't know doing all this live radio is going to make my lips chap. I'm going to need my CareFirst card for chapped lips. Do you have something for that? Yeah, I don't know. I have Vaseline, but my lips hurt real bad. We're going to make it till 5 o'clock today. We have lots of guests coming by, friends coming by. Mike Rosenfeld's going to be here from Web Connection to co-host me, and he's the internet guru. He's going to you like my little light bright? I didn't get a light bright when I was a kid.
It's very retro.
It's a
It's
really
adorable.
expensive
I want to.
light
Can I
bright,
touch?
but-
No.
No.
Just
I don't
joking.
even know how to. I'm
Ness,
afraid to touch
I'm
it. No.
just joking.
You don't know. I'm scarred from knocking
You've been
myself
through
off
some
the radio.
things.
It's been a week.
We can check into your behavioral health.
My mental health is going to be way better at 5 o'clock, especially because there's a bar right here. Back for more live from Pappas. We're really live. Stay with us.